That's another stigma. That today, if somebody has prostatitis,
And to measure again, you would either need to pee or give a semen probe, and then it takes 3-4 days until we have a result from the culture.
Let's dispense the antibiotics and get on.
Correct. Yeah.
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 That's
so
true.
this is very typical also for other parts. I mean, if it's dental, if it's end of the day, I still see that too many people are getting, especially Augmentin. That is the go-to medication. If to cough twice, it's Augmentin. Yeah, go ahead. Although it's a viral infection, although bacterial infection is not there yet. And then why always this poor Augmentin? I mean, this guy is. I mean, every bacteria is resistant to it already. So it's changed a little bit, but it's because also the patient requires it. Yeah. I mean, if you don't give it to them, so why don't you give it to me? Yeah. I obviously have something, it has to be taken care of fast, give me something.
Correct.
Yeah.
So there is that push or pull factor from the patient himself also. Correct, and the doctor sometimes is just caught in between. Fine, go ahead, yeah, take it. Yeah.
And most people, like you or myself, luckily, don't have the time. If I see that the poor housemanship doctors or medical officers, are they called in Malaysia, they have to see like 70, 80 patients a day. Yeah. How do you have the time to explain something to the patient, come back in 4 or 5 days, we do something again? He's happy that this patient doesn't come back at all, because that would add to his workload, go from 80 to 140. So I have an understanding, and it's not something where we can do anything against it. It's more also on the patient. Sometimes I think that they invest time and money and effort to seek somebody who has more time and has the expertise. Again, medical officers have not the expertise nor the knowledge. I mean, they have a very, very good knowledge about broad spectrum. And if you are sick, very sick, they will definitely help you. But in chronic diseases, it's very difficult to pinpoint what is actually the problem. Yes. So even you tell, so it's not easy to diagnose. You have to tick the boxes, and then you have to go into the therapy.